proactive team and friends. I just wanted to offer up some foam rolling suggestions for everybody. I know a lot of people are working from home, maybe longer hours, or perhaps there's some people who are working out a little bit more because they have some more time at home. And so foam rolling can be a great way to self-massage. There was a video on the therapy balls last week, which was great. And this one is something that a lot of our patients use. A lot of our patients have a foam roller at home. You've probably seen them before at the gym or in workout videos. Now, sometimes they can be as tall as 3 feet. Sometimes they're about half of this size. This is a great one for home just because it's small and compact. And they come in all different kinds, different densities. The one that I'm using here has the PVC type innards, so it's really firm. So the people who say that, oh, they squish down the foam rollers, this one you're not going to squish down. It's definitely very firm with just a foam surface. Now there's other kinds that have bumps on the outside. Those are called rumble rollers. Athletes use all different kinds, but this one is a great one for home use, and it's the type that you're going to be able to do just a few easy things. Mainly what we're going to focus on today is low back, hips, and just loosening up the tightness that sometimes gets you towards back pain and the reasons that you'd often see a chiropractor. So a lot of our patients, like I said, have this, will do these type of things, and it's definitely going to help. I'm just going to switch this so you can see a little bit better. Okay, hopefully that works. And if you have one, you're going to start by sitting on top just like I am here. You're going to cross one foot on top of the other, and if you're a very tight person and this is very difficult, you're going to move your bottom foot out and away, and if you need more of a stretch, you're going to pull it in. So you're going to be sitting in your cross-leg figure 4, some people call it, just up on top of the foam roller. And then for stability, you're going to put your hands behind you and roll back, so you're almost on your tailbone, more towards your glutes. And we're going to focus on one glute at a time. So you're going to tip towards the side of the leg that's up. So you're just on those glutes, and you're going to roll back and forth a couple inches either way, and you're going to roll, just loosening up the glutes. And you can do the opposite where you tip back and forth, alternating this way, and that's going to massage the glutes as well. Each of these foam roller positions you might spend 20 seconds to a minute on, and you'll know the spots that hurt the most are the ones that need it the most, and you can get in there as much as you need. So of course, to do the other side, I'm going to show you from the side. So your foam roller, you are sitting on top. You're going to cross the one ankle over top the knee, and depending if you're less flexible, you're out here. If you're more flexible, you're in here. And you're going to first tip onto that side, so you're just on the glute. You're going to roll back and forth. So up and down is one way, and then of course across this way. Sometimes this is enough to loosen up if you have tight back, tight hips. It's enough to loosen up and just feel like that is less painful for you. So that's the first one that you'll go into. And then next you're going to go onto your back. So if you are strong enough, you're going to hold yourself up with your feet on the ground, and you're going to put your hands on top of your shoulders as you roll. So your feet are pushing you, and you're going to roll across your low back. Sometimes you feel a few pops, which is fine. Sometimes you just feel the muscles tight where you're loosening up. Now, of course, we can do this all the way up to the shoulders, and we sometimes do go all the way up here. But we're focusing on low back today, so we're just going to do low back. We've already rolled out the glutes. And then what I really like to get hip flexors, because that's a tough one to stretch at home, your hip flexors sit in front or on top of your hips here, is to lay back. Let's see if we can get this in the shot. Your hips are up on the foam roller. Your shoulders and your head are back on the ground. So you're in a bit of an inversion. This alone is really nice, and I have some patients that are doing this right now, whether it's for a disc issue, sciatica, nerve pain. Sometimes this can be very relieving because it stretches out your spine. It's like an inversion table without having to buy an inversion table. So your hips are up, you're just resting, your head's resting on the ground, and just that light inversion on your spine kind of pulls, tractions, gravity, gives some space. and it's usually recommended 2 minutes. 2 minutes is enough here. It's definitely enough if you're in more of acute low back pain. And once you're done your inversion, you are going to stretch out one leg, pull the other knee in towards your chest, and let this leg kind of stretch and lengthen out. Some people have to hold their leg up just to get the stretch, and some people, it'll do it automatically. But this is an excellent way to get a hip flexion stretch because it's very difficult to stretch the front of the hips. Most of us, if you sit or if you drive all the time, these ones are short. They're always short. They're always tight. They never get lengthened out, and that can create some back pain. So this is a great way to do it. You're just going to hold. You can rock your knee in and out if you're preferring that. And then as an added bonus, you can stretch over the top, which is going to roll your bottom glute, but also stretch and give you a bit of a twist on this side. So of course, you do it on both. One knee in, one knee out, and I would hold this for at least 30 seconds. 30 seconds to a minute would be ideal. Rock in and out if you want. And you can twist if you want. So, that's a very simple way to start some foam rolling. If you have one at home, those are some great ones to loosen up your low back. And as a chiropractor, that's definitely something that we see a lot of. And this is a great way to just loosen things up, whether you're just a bit stiff and tight, or if you're starting to get some real pain down there, you need to loosen up. Now, there's other things to roll and other things to do, but we will talk about that perhaps in a future video. Thanks for listening.